There are 7 winning projects in this year's National Healthcare Innovation and Productivity Awards. Among them, a system that's been instrumental in managing bed capacity and patient flow at one hospital during COVID-19, and a program that's helped elderly patients shorten their hospital stay after surgery by 2 to 3 days.
Using artificial intelligence to aid hospital-wide operations is the Command, Control and Communications C3 system, which was rolled out at Tan Tock Seng Hospital last December. Its disease outbreak module was still in the pipeline when COVID-19 hit. The hospital, however, sped up its implementation when more people started turning up at its screening centre.
We knew that an increased number of patients coming to the screening centre will lead to more admissions, and that in turn will mean that there is an increased demand for our inpatient beds. So in a matter of 48 hours, we actually rallied the resources to be able to turn an additional 100 beds operational.
Only 2 to 3 people per shift are needed to man C3, which has been developed to monitor and coordinate resources for different scenarios.
It's almost near impossible for a human mind to really identify what is the best bed arrangement for the patients who requires admission. The system actually helps us prioritize which of these patients are more critically ill and requires admission. And for each patient, we will then have recommendation systems to really suggest to the user what are the top 5 most suitable beds for each one of these patients.
Over at the Singapore General Hospital, a team of about 10 has designed a perioperative program for elderly, which started in January last year. It includes a tool that identifies frail seniors during assessments before the operations.
We're talking about exercise, we're talking about nutrition, and all these factors which were not traditionally given, importance. So we throw all of this in within the same center, and making sure that it is bespoke to each individual patient, because we realize that in the elderly, there's no cookie-cutter approach.
82-year-old patient Chan Lai Lin is one of the 120 patients who has benefited from the program so far. Madam Chan had a surgery to remove a part of her colon last August and was discharged after a week.
For maybe about 3 to 4 years before the surgery, she didn't really do any active exercises. And in fact, she found it difficult to walk. But I think during the sessions with the physiotherapy and when they call her, they were actually also encouraging her. So it's very funny. Sometimes she's less motivated to do her exercises, and then the call comes, and then I notice that she starts doing her exercises right after the call.
SGH has, from this year, opened the program to all frail elderly patients, 65 years old and above, undergoing surgery.